Dear friends, welcome back to Alpha Physio Pelvic Care, all things pelvic health. If you're seeing me for the first time on YouTube, my name is Anastasia Ovarova and I'm practicing pelvic floor physiotherapist in sunny Cyprus. And I've been practicing in this profession now for over 10 years. I see male, female and children, all different populations. And here on my channel I share all my tips and tricks and advice on pelvic health. Before we begin with this video, I would really appreciate if you drop a like under this video. It really motivates me to share my knowledge and experience with you. If you don't want to miss anything pelvic health and you want to stay up to date with information as well as get my best tips and exercises on pelvic health, make sure you subscribe to my channel and to get notification for the new video. Today, I will talk about something that I'm talking every single day about. This is the topic that, in my personal opinion, because I'm in the profession, is talked again and again and again. But I did realize, and I do realize, that this is a little bit professional distortion because, in fact, it is a huge taboo. And we will talk today about urinary incontinence and also erectile incontinence after birth. Something that happens to every third woman at some extent, and that if they don't experience it immediately, they might experience it later in life. It is completely dismissed. Today we'll talk about why this is happening specifically after pregnancy, what to do about it, steps to take, and what impact it can have on a social life. Stress urinary incontinence is basically your inability to hold urine and have a urination in a controlled manner. So you can't make it to the toilet on time, or you leak urine during sneezing, coughing, exercises, or maybe not in a particular effort, maybe when you change position. Why this is particularly happens after pregnancy? Pregnancy is a big stress on female's body. As the baby grows, tummy grows, the muscles of the abdominals overstretch, and these are our supportive muscles, core muscles, as well as our pelvic floor muscles, the muscles that sit at the bottom of the pelvis and basically keep everything inside, including our organs, and also control our ability to go to the toilet when we want and hold when we are not ready yet to go, or we're not at a toilet yet. These muscles become overstretched up to 300%. That means 3 times. So even if you had a cesarean section, because there is a wrong assumption that if you had a cesarean section you will preserve your pelvic floor muscles, you will be fine, you won't have leaks. That's absolutely a myth. During the pregnancy, if you carried more or less to the full term, your pelvic floor muscles went under the strain. They have been overstretched and they already need rehabilitation. As you go through labor, let's say vaginal birth, pelvic floor muscles overstretch a lot and then they need time to go back to their normal position. It may happen, let's say, automatically, but for most women they might have cuts, they might have tears, they might have stitches, so pelvic floor injury will occur. For women who had a cesarean birth, they have major abdominal operation, a lot of pain, lower tummy is inhibited, the muscles are inhibited, they're not working correctly. A cesarean section is very close to the pelvic floor. It's not like you have it around your abdominal and then, oh well, it's far away from my ladies' bits, it's fine. Everything is really interlocked and really close. When you don't have enough abdominal strength, when you have the pain all around the area and the pulling, your pelvic floor also might become weak. So it doesn't really matter what mode of delivery you had. What matters is that everybody needs a rehabilitation. And quite often women are told, well, it's okay, you give birth, what did you expect? I have never ever heard this, for example, to a runner. Well, it's okay, you're a runner, you injured your hamstring, get over it and get on with your life. No, there are suggested therapy, they are suggested physiotherapy, rehabilitation, resting period and so on. Or same with somebody who does any type of exercises. Somebody who broke their arm, well, you slipped, your arm broke, what to do? Leave it. They are given certain period of rest and then rehabilitation. Absolutely same with the pelvic floor. Don't let anyone tell you that urinary incontinence is normal. Urinary incontinence is indicator of weakness of the pelvic floor or a dysfunction rather. Sometimes it can be also tightness when pelvic floor is not contracting properly because it's already in the contracted space, in the contracted state. Like for example, contracted biceps. You can't do anything with the contracted biceps. Here with the flexed elbow is non-functional. It's very hard to function with the hand like this. So we need to have a full mobility of the hand in order to be able to use it normally. And same with the pelvic floor. Another reason why urinary incontinence may occur. Very often, a woman will come to me after giving birth, and not immediately. Maybe some months would pass, 3, 4, 6, up to a year, let's say, or maybe more even. And they would say, I had a little bit of leak straight after the birth, which is expected. Super overstretched pelvic floor, you might leak for the first week after birth, after second, but it will improve very fast. And then what happens is this woman goes to the doctor says everything looks perfect, everything looks fine, your stitches are fine, your uterus back to your normal size, remove stitches from the cesarean section, you can go and exercise now, go back to your normal. And this is the biggest mistake ever, because you need to retrain your body from the beginning, from the basic, with your breathing, with your core engagement, and have gradual return to your activity, especially if it is a high impact activity, Zumba, running, like boxing classes, something that is fast, HIIT training, high intensity training. And this is where women start to go back to their normal, at the same output like they were before pregnancy and birth. And in a few weeks, in a month's time, they start leaking, and leaking even more than they were before, because they do crunches, because they start lifting heavy weights, exactly same like they were lifting before, whilst maybe not doing the training throughout the pregnancy, or maybe significantly reducing their training, and then immediately going back. No, there should be a rehabilitation period for at least 8 weeks, really depending on individuals, but 8 weeks is like given rehabilitation period where you focus only on your pelvic floor, posture, breathing, spinal mobility, hip mobility, and basically bringing your body together. There are other reasons why women might be having incontinence after birth that are more of a contributing factors. This might be bigger fluid intake, of course, because if they're breastfeeding, they're drinking more. Maybe moms are running on a coffee a lot, and caffeine is diuretic as well. Therefore, it's very important to see what are we taking in and what might be so-called bladder irritants. So things like teas, green teas and coffees, and also even herbal teas might irritate your bladder even if you don't consume a huge amount of them. Or maybe you like a little bit of Coca-Cola here and there, or Fanta, or see if these things are irritating your bladder and makes you go more or more frequent. Hormones also can be all over the place. You had very high levels of estrogen, progesterone, then it suddenly dropped, and because all of these are affecting our muscles, not only pelvic floor, but because pelvic floor is a muscle, it can also temporarily inhibit it and weaken. However, it's usually not a major contributing factor. This is something just to take into consideration. What I would not suggest for you to do is take approach of sit and wait. Even if you are lucky enough to wait it out and having your incontinence improved, the fact that you already have it makes you predisposed to having it again, maybe later in life, maybe in perimenopause and menopause. So even if you are feeling fine, take some time to focus on your pelvic floor. do some exercises with the breathing and post-pregnancy recovery exercises. I have a special program that I'm running live, but also there are recordings of it, and right now the next round starting on 14th of May. If you don't manage to join, you can always get the recordings and work through them in your own time, and there is a link in the description below. Also, I would not suggest you to simply ignore the leaks and hope that they will go by themselves. If you already having the leaks and you see that they don't improve by themselves, a wait and see approach is really not the best. It's better to take proactive approach and start to incorporate your pelvic floor exercise in your daily life. I do get clients who they like their exercises, they like their Pilates, they would like to continue with it, and therefore I often give them advice on how they can incorporate the actual pelvic floor engagement and be more conscious of it in the certain exercises that they already do in order to improve their condition, as well as to make sure they don't make it worse. Sometimes there are a few exercises that then I find it hard, so I give them modification so it's easier for them to control that exercise. Another thing that I would not rely on heavily is incontinence products such as pads and period pants. Don't get me wrong, if you need to go in a social setting, and the whole incontinence thing can really affect your social life. It can make you stop to go to the gym, to go out, to go run, to go dance because you leak. And by all means, if you need these products in order to be socially active, do use them. So you know you're going out for a bit of a dance and you know you have prone to leak. That's fine. Use the pad or period pad to make sure you are confident in yourself. But do not just stay there and ignore the fact that you are actually leaking. Whilst you can use these strategies to make sure there is no awkward social situation, please take steps, address the actual root cause, because in my experience, things are not getting usually better by themselves, especially if the experiences came after first birth and you are planning more babies. And even if you don't, then we still have menopause and different changes happening in our pelvic floor, and I have a special separate playlist for the menopause. You can check it out. I hope this video, guys, shed some light. It gave you a bit of motivation to take better care of your pelvic floor and on your pelvic health, because this is really the most intimate part of our bodies. We don't discuss about our pelvic floor regularly. This is not a common topic of discussion, but I do find out that when I bring my profession, you know, and we are like with some bunch of women, almost all of them will have something to say about it. Almost all of them would have experienced leaks or any awkward situation or you know, pelvic pain or any other things. And all women regardless of their birthing status. So this is very important part of our body. Let's take good care of it, and I hope you do. Let me know what is your experience after birth, or generally, have you experienced leaks? What have you been told? Have you seen any professional about it, or you are just not sure where to go? You can always start with your gynecologist, with urologist. You can always find pelvic floor physiotherapists. Many are working online, including myself. So you can always have a consultations, your questions answered, and get some tips and advice. I hope this video helped you, and we'll see you back very soon. Bye.